Today is Friday, August 6th. Welcome to this edition of Nevada County Now. Today's episode we're talking river fire, COVID spike, Cashins field, and more. Hello and welcome to Nevada County Now. I'm your host, Cole Pettit. It's been an eventful week here in Nevada County. The river fire began Wednesday afternoon at about 2 p.m., and as of the CAL FIRE update at 7 a.m. this morning, it has burned 2,600 acres and sits at 30% containment. 88 structures have been destroyed with an additional 20 damaged, and 3,400 structures are threatened. At the time of filming, evacuation orders remain in effect for both Nevada and Placer counties, and the areas which were under a warning have been cleared to repopulate. In Nevada County, 6 zones remained under evacuation orders. Placer County has 3 zones under evacuation orders. We'll leave links to view both counties' dashboards in the description, which is where you'll find the most current information. And of course, along with the fires comes the smoke, which we're all experiencing today. The Northern Sierra Air Quality Management District and the Public Health Departments of Nevada, Plumas, and Sierra counties are extending a joint air quality health advisory due to the prolonged and widespread smoke from the numerous wildfires, predominantly the Dixie Fire, which has now burned over 432,000 acres and is 35% contained. Poor air quality, possibly reaching hazardous levels, is expected to persist as long as these wildfires are active. Smoke density and location will vary greatly depending on fire behavior and weather conditions, with smoke settling in low areas at night. If you smell or see smoke around you, the following actions are recommended. Minimize outdoor activities even if you're healthy. Stay indoors with doors and windows closed as much as possible. Run the air conditioner on the recirculate setting if that's an option. People with asthma should follow their asthma management plan, and people with heart disease, respiratory conditions, or chronic health issues should stay indoors. Contact your doctor if you have symptoms of cough, shortness of breath, chest pain, or severe fatigue. Keep airways moist and stay hydrated by drinking plenty of water. Avoid breathing additional smoke, such as from cigarettes or barbecues. To view the current air quality, visit airnow.gov. Despite the hardships many have dealt with this week, we can always count on our fellow community members to step up and lend a hand, and this situation is no different. Here is just a short list of some of the donations that have taken place so far. Heartwood in Nevada City donated food. Kristen Stanton of Garage Door Express donated a trailer of water and ice to the fairgrounds. Christine Abbott Anderson donated cash at the fairgrounds. Elizabeth Zapata donated towels, buckets, and loaned cat carriers to the fairgrounds. In-town campground donated spaces for several households. Rafe A. Ellis is ministering to a truly diverse group, all shapes, sizes, numbers of legs, fur, feathers, and hair at the fairgrounds. Sourdough & Co. and India Oven offered a complimentary lunch to firefighters or any first responders going to fight the fire. Emily's Catering donated 50 meals to the volunteers and folks helping at the Nevada County animal evacuations at the Nevada County Fairgrounds. Animal Place donated nearly $400 in supplies to Animal Evac, which included shavings, horse buckets, chicken feed, and duck pellets. And some evacuees who are residing in hotels have had their bills paid by an anonymous person or persons. If you'd like to help as well, the Nevada County Relief Fund's Community Advisory Council established the River Fire Fund to accept donations and will direct funds as they learn from their nonprofit and county partners where the needs are greatest. All funds raised as of August 5th will be made available to wildfire survivors from Nevada County. The County Department of Social Services caseworkers will vet requests for assistance, and they'll have Sierra Nevada Memorial Hospital Foundation serving as the Nevada County Relief Fund's fiscal sponsors. Donations may be made safely and are tax deductible. To donate to the Relief Fund, visit nevcorelief.org/fire relief. You could also support the Nevada County Veterinary Disaster Response Team. You can donate in person at Simply Country or go to nevadacountyanimal.evac.org and hit the donate button at the top. And for our friends in Placer County, you can donate to the Placer Community Foundation by visiting placercf.org. We've seen an increase of 421 COVID-19 cases this week, more than doubling last week's numbers. Tuesday alone saw an increase of 140 cases, our third highest one-day total since the pandemic began. Our overall total now sits at 5,771 confirmed cases. 434 cases are currently active. Our hospitalizations doubled as well this week to 14, but thankfully the death toll remains at 75. I spoke with Dr. Brian Evans, CEO of Sierra Nevada Memorial Hospital, and also now CEO of Mercy Hospital Folsom, about the current COVID situation.
We've actually seen a pretty steady increase in the number of COVID hospitalizations, both at Sierra Nevada as well as at Mercy Folsom. And I'm keeping track of the region as a whole, what's going on in surrounding counties, especially Sacramento County, which is, got the biggest population center. And really, there's not a big difference between what we're seeing within our region and other places across the country. This Delta variant is more contagious than prior variants in this COVID family. And Delta is now the dominant variant that we're seeing for people that are infected with COVID-19. So it's resulting in more cases. It's certainly resulting in more hospitalizations and deaths now. Because of because of how contagious it is, and also it seems to be affecting folks more severely in some cases. We've seen a shift towards individuals being hospitalized that are younger than at the beginning of the pandemic. When we were looking at the beginning of the pandemic, the majority of the folks were really older people. They were definitely disproportionately affected. But now we're seeing a younger population of people in the hospital than we did before. And that may be partly due to the fact that younger people are a little less likely to be vaccinated. We are still seeing that the vast majority of hospitalizations and deaths from COVID across the country are in unvaccinated individuals. So the vaccines are very helpful at reducing the risk of hospitalization and death. But that said, we are also seeing breakthrough infections in people that are vaccinated. So I think it's important for people to understand that distinction that, even if you're vaccinated, you could still get COVID-19, you could still transmit it. But you're way better off having the vaccination on board because it prevents you from getting very, very ill and hospitalized the vast majority of the time.
Got it. And so touching on those, the younger population, all the schools are sort of getting ready to go back into session at this point, and at least here in Nevada County, the superintendent of schools has put out let them know that there's going to be a mask mandate requirement for all the students and all of that. But with this Delta variant, are we starting to see more cases even in children, and kind of what ages are we talking about there?
Yeah, we do know that children are getting infected with COVID-19. Obviously, there's no approved vaccine for children less than 12 years old, and they can certainly get the infection. We have, earlier in the pandemic, it really was very clear that children were much less likely to get seriously ill from COVID-19, but it wasn't impossible. Now we're starting to see an uptick in hospitalized children and children getting pretty seriously ill. It's still not huge numbers, but it's possible. And so we do want to think about that. And I think that that's part of the reason why the mask mandate came from the state of California. And then, the other reason I think for it is that if the virus is being spread around amongst children, they can certainly give it to other family members and people who are more vulnerable to the infection. And so that's problematic. But there's no ideal way forward here because it really is logistically challenging to do the masks and the mandates, and a lot of people are not happy about it, obviously. But that's the decision that's been made at the state level, and I know that the county schools are going to adhere to that. Some people initially were saying, "Well, I don't know about this vaccine. It sounds new. It sounds like we don't really know everything about it. I'm going to wait and see." And a lot of people are kind of in that camp of the wait and see camp. I think now at this point, there have been so many doses administered of both the Pfizer and the Moderna vaccine and other vaccines that we've really seen an excellent safety profile with these vaccinations. And they're very, very effective at preventing death and serious harm from COVID. I think that people need to really be thinking about a couple of things. One is, the healthcare workers, the folks who are on the front lines are really exhausted. And it's not just in our community, but it certainly includes our community. We've got lab techs and EVS workers and nursing and physicians and many other people who have really been working hard for the last year and a half. And we kind of all psychologically started feeling like, okay, maybe we've got this pandemic to a point where we're okay now. And then along comes Delta, and Delta has resulted in what is the fourth wave in California of the COVID pandemic. And that's really very challenging for everybody. So we've got all these folks who are taking care of patients now in the hospital who for the most part are not vaccinated, and it's preventable. And so the healthcare workers are getting frustrated, they're getting burned out, and it's just very hard on them. And, we need to deal with that. And the worst thing would be a huge spike in COVID-19 cases right now. And unfortunately, we could be heading in that direction. Again, it's a preventable thing. If we all get vaccinated, it will really help us. Communities that have higher vaccination rates are less impacted by these COVID surges. And I'd really like to see Nevada County get to a much higher percentage of vaccination.
Yeah, you and me both. Well, thank you for taking the time to join us today, Dr. Evans.
My pleasure, Cole. Thank you.
Right. Thanks, Dr. Evans. As a reminder, vaccine appointments are still widely available through myturn.ca.gov, including one-time pop-up clinics by our Nevada County Reach team, walk-in clinics, or to request transportation assistance or an in-home vaccination appointment. In more positive news, the official groundbreaking for the Cashins Field project in Nevada City took place on Thursday. For those unaware, this project is located at 170 Ridge Road in Nevada City and is an affordable housing project consisting of 51 units of workforce housing. Representatives from the City of Nevada City, the County of Nevada, the Regional Housing Authority and Affordable Housing Development Corporation, and the Nisenan Tribe were all on hand to participate in the groundbreaking ceremony. Let's take a look at this event.
Yeah, so this is an exciting time here to be at the groundbreaking of the Cashins Field Workforce Development Project. It was a long time coming, and then it just happened fast, and that is due to the incredible partnerships that were built here and that were used between the Regional Housing Authority, the developers, the builders, the architects, the finance people, the county and the city, everyone working together towards the same goal, which is to provide more workforce housing for Nevada City and in Nevada County.
From the beginning, this development has been quite a community effort. As I have worked in dozens of jurisdictions throughout California, it is very unique for a city and a county to be so collaborative and work together with a mutual intention. Local outreach to the community, we had informational meetings, we did thorough discussions about the mother lode design to make sure the design intent fit within your community. We endured an 18-month plus process, I think, to get here today, and it's a priority for all of us to provide housing for the residents that serve this special place of Nevada City.
We never get projects, ever, in which the people that do this for us and with us allow us to have input. So it was a shock and a pleasure to be able to have some input on the aesthetics, the layout, so it fit into our community property, which is always a big issue here with a historically designated community is, oh boy, we're going to have something that doesn't fit in. This fits in wonderfully. So I want to thank everybody at the county. That was big. And I remember being asked to attend a meeting, and I sat down, and I think it was Allison, Molly, everybody, they kind of started presenting this idea. And I think they were a little afraid, of kind of looking at me like, And I mean, the attitude was, of course, couldn't you build it yesterday? And I think everybody was relieved. And of course, a lot of us have been fighting for these types of projects since we've been involved, in public leadership. And usually it's a struggle. We have, as mentioned here with the NIMBYs, the same small group of naysayers that we run into that live in a Victorian, and they happily go down to the bike shop and have our employees that are making minimum wage help them, or go to a restaurant or coffee house, or an event at the foundry that has a catering company, which most of the staff are minimum wage at best. But then they walk around and try to roadblock these projects. And I want to say thank you to everybody here that stuck by their guns this time and didn't bow down to that small vocal minority, and realize how critical this is for our community, period, and other communities. And I'm hoping that this will start the momentum we need. We still have Providence Mine. We still have the HEW property. We've got so many things. We've got a sliver of property right behind this that we penciled in back in the 90s that could handle 30 units, and it still sits there vacant as we speak with a private property owner. But maybe this is the type of thing that needs to kickstart more and more of these.
It was really exciting to be asked to give some ideas to rename Cashin Field, and the word that we found is, it's a little bit of it's a sound, which is always hard for me to make because I speak English. Takudi, which means like little field in Nisenan. So, and it's cute, and I like the way it's written. So I think it's a name that might catch on if people start using it and getting the Nisenan words and language back on the landscape here. And this was a great opportunity to do that. So,
we approached the tribe about naming our community center. And I'm not going to try to repeat it because she did such a wonderful job. But we wanted to honor, obviously, the land that we stand on and that we're respectfully building on. And so they came up with the name, and I just love it. And I can't wait to, have that community center fully built and dedicated to the tribe. So thank you so much.
This really is a great event. When I came on the property, I saw C&D and Charlie's vehicles, and I saw DMCE and Dave's crew, and I was real happy to see that because I saw Sinceri and others. But it's nice to see locals are out here working and doing good for our community. This is a great event. To me, the key to the success, and it's been mentioned time and time again, is the partnerships that were established. Our investment partners, construction partners, everyone working together. And Gus and I were talking, this is the fastest project we have ever seen occur since I've been on the Region Housing Authority. Heidi Hall, who is our District 1 supervisor, this is Heidi's district. And Heidi was a champion for this project because she recognized the need that we had here to establish more affordable housing. And what a perfect location, and what a perfect addition to Nevada City and everything that Nevada City is trying to do.
Today is International Beer Day, and with all we've been through this week, I think we could all use a cold one. Thank you, sir. It's always important to use any excuse to spend more time with friends or loved ones. To those of you who have lost homes or are still evacuated, we're sending you all our positive thoughts and will continue to support you as best we can. And to our firefighters and first responders, thanks for all your hard work and sacrifice to keep us safe. Here's to you. We'll leave you tonight with some footage from National Night Out, which is an annual community building campaign that promotes police-community partnerships and neighborhood camaraderie to make our neighborhoods safer and more caring places to live. It took place Tuesday evening and had several activities for kids to participate in. Representatives from our local law enforcement agencies were in attendance with a special guest, a sheriff canine named Ranger, who is sponsored by the Rudiger Foundation. Enjoy these clips from this community event. And remember, stay safe, take care of each other. We'll see you next week.